Hello, everyone, and welcome to the Collective Impact webinar series. We're so happy to have you here with us today in our June webinar. All right, next slide. So the USBC staff team that is supporting this webinar series includes Amelia Smythe, our Interim Executive Director, Kinkini Banerjee, the Coalition's Relations Director, and myself, Alyssa Spies, the Constellation Program Manager. Next slide. So a little background, this series is made possible with funding from both CDC and the W.K. Kellogg Foundation that helps us do this series of bi-monthly webinars, which are held on the fourth Tuesday of the month on even-numbered months. And this is a place for us to bring together coalitions and organizations to share best practices and news about using the collective impact model for collaborative change. So this webinar is open to all interested breastfeeding advocates. We post information about each topic speaker before the session on the Collective Impact page. We also, that is the place where we share the recordings of the webinars for those who are not able to listen live. Next slide, please. So as you may know, the series is set up so that you only have to register once, and then you'll get auto reminders. And also, if you register, you will be sent the link to the webinar and the archives of past webinars and materials so that you can catch up when you have time. Next slide. So to find the past sessions, you can follow the link that is in your reminder emails, or you can go to usbreastfeeding.org/collective-impact. Next slide. We also have made it easier, so when you go to the USBC homepage and you find webinars at the top of that page, you see the Collective Impact webinar series in that drop-down menu, and clicking on that will bring you to the archives and information about any upcoming series that we have. So during the session, attendees are in listen-only mode. We will have time for questions and answers after the presentation. You can submit them at any time during the webinar. You will have a questions box on your webinar control panel that you can enter that into. Next slide. So this is what your webinar control panel should look like. It has information about your audio connection at the top. Your questions bar might be minimized, so you might have to click on it and get the arrow pointing down so it pops open. And then you will be able to type your question into that box so that we can see that for the Q&A session at the end. So if you're having any issues connecting or things like that, you can email office@usbreastfeeding.org, and we'll try to help assist in any way we can to make sure you can get connected. Next slide. So I'm very excited to introduce our topic for today. We have a great presenter talking about beyond collaboration, how to create a culture of belonging. And you may have seen in the chat box, I asked folks to introduce yourselves, so you can give name, location, organization, and then what your definition or idea of what it means, what belonging means. And I am very excited and honored to be able to introduce today's presenter, Dr. Ernelyn Navarro, Manager of Community Programs at St. Mary's Medical System at St. Joseph Hospital. As a social worker for 37 years, Ernie is passionate about empowering and helping people and communities, and as a leader for the past 29 years, she coaches and mentors other leaders and staff to create and fulfill their meaningful legacies. As a caregiver at St. Joseph Health, she serves as the manager of community programs and services and has done many great things, including serving as the lead for the Baby Friendly Hospital Initiative. She is an adjunct professor at the University of Southern California's Masters of Social Work and also advises and teaches in the Doctor of Social Work program at USC as well. In her private practice, she provides leadership coaching and professional training for hospitals, nonprofit organizations, and she currently supports a national organization, Leadership Education for Asia Pacific, LEAP, as a contracted executive coach. Ernie has also served on the board of directors for the California Breastfeeding Coalition. She served 3 years as the board chair and president, and 2 years as the co-chair of the Summit Planning Committee. And she's bringing a lot of that experience with the California Breastfeeding Coalition directly into the examples that she shares with the audience today. We're very excited that today Ernie is going to be sharing with us about how to create a culture of belonging and collaborative work. As we know, there are many available resources for the theoretical frameworks for collective impact and other models of collaboration. And many of them stress how relationship building is a key part of success. But fewer, talk really about how to do that relationship building that is so necessary to see a collaborative thrive. So Ernie is also here to talk about, effective relationship building within the common time constraints that many projects have. So how to make the most of the time and the connections and the people and the relationships that are involved with these projects. And with that, I'm going to turn it over to Ernie.
Great, thank you. All right. Hi, everyone, welcome. And so wanted to be able to take this opportunity to share our story in terms of what we've been doing here in California to strengthen our culture of belonging, and wanted to be able to give you some tips. And so part of the reason why we feel this session is important is that, as Lisa was saying earlier, when we started to implement collective impact, there wasn't a whole lot that we can get as far as the how-to. So we understood the concept, and I think everybody buys into that we all need each other to work and collaborate. But the whole purpose of really being able to then put into place that future that we imagine, and understanding how do we transform from individual group of organization, or this notion of collective impact, and how do we change the culture, how do we change the mindset of individuals as well as organization. So a lot of the work that I will be introducing today is a combination of the work from Peter Block, who writes about community and talks about the creating structure of belonging. So part of why belonging matters, I think we all can agree, just in terms of a lot of us now feeling isolated, fragmented in the different arenas that we operate in, whether it's in healthcare system or in the political world or in just the community. So part of that sense of belonging is really making people feel that they are creators and investors and owners of what it is that they're a part of. And so we are all wired to belong to a group or our family. And so we want to be able to take that into the work that we're doing with our coalition or our collaborative. And so just a quick link into where belonging sits as far as the work that we're doing with collective impact. So here in one of the 5 dimensions or conditions of collective impact talks about communication, and it says focus on building trust, and then creating that open communication, and of course all of the coordination of convening people. So again, these are great principles, and really we understand kind of what the needs are. So my goal is to be able to give you some tips on how to put into action these conditions for collective impact. And a lot of you are probably doing great things in terms of how you're tackling each of these different areas. But again, we wanted to be able to share with you what we're doing here in California. So I wanted to be able to also give you why it was important for us to apply collective impact, because in our mission statement, at the core of our mission statement is collaboration, or collaboratively working with other people. So we see ourselves at California Breastfeeding at the state level as the coalition that supports local coalitions within our state and other advocates in our state. So part of why we exist is being able to then pull all of these groups of people in our big state and to be able to work together for a common purpose and a common vision. And so what we did, or what guided our work in everything that we're doing as far as our missions, our mission statement and our goals. And so wanted to be able to start there and walk you through that. So part of what we do as a coalition, again, is looking at putting in place the Healthy People 2020 objectives, of course, and our vision is that there are no barriers to breastfeeding in California, and so where we focus our goals and activities around hospitals, workplaces, and healthcare systems in general. So part of what also guides our work, and again, this is where why coalition building and collective impact fits in the work that we're doing. So we actually use the spectrum of prevention to guide our work. And so when you go to our website, you'll see that we do a lot of advocacy policy work, and as well as building or fostering coalition and networks. So part of that spectrum of prevention is how do you foster coalition and the network, and how do you strengthen the community as far as a way to implement all of the different aspects of work that we're trying to do. So part of what we decided to do very early on is to layer our framework with different best practices and different models on how we go about putting our action plan. And so the other piece that really guides our work is that we use the call to action by Surgeon General call to action to support breastfeeding. And so we've looked at that as a way to pay attention to some of the initiatives that we're doing, workshops that we present. And so again, it's tied into our vision of no barriers to breastfeeding in California. So as some of you are familiar with the call to action, in that document, they identified 7 barriers to breastfeeding. So our workshops and again, different advocacy work revolve on these 7 barriers that we're addressing. And then the other piece that we also decided to do in our work, and why collective impact has become part of the work that we do, is that we did align our work with USBC strategic framework, especially around equity and as well as the collective impact model. And so when this was first introduced, a few of us were at that convening, and then we decided pretty much at our board meeting that this is something that we wanted to adopt and layer on top of everything else, because everything else fits. But this in particular addressed what we wanted to focus on: inclusion and diversity and equity. And so I know in the chat box, we wanted to be able to get an idea of what people's definitions and perspective of belonging. So I mentioned earlier, a lot of the framework that I'm using in this presentation is in Peter Block's work on community, the structure of belonging. And so part of what we are understanding of community is, at this point, most of us, want to be able to shift our mindset of being able to, work in a community where we're not competing, or there's this scarcity mindset, or we're siloed and fragmented. So we wanted to be able to create this community in a way that people feel welcome, again, the inclusion aspect of it, and be able to feel connected with one another. So for those of you who've been to California, and we have a large state to cover as far as, and people really not having the opportunity to interact and work with each other, except for when we have our annual convening. And so how do we go about making sure people up north in San Francisco feel connected with a coalition in San Diego, and be able to develop that relationship so they can share with their resources and share ideas, as well as be able to celebrate each other's successes in in all of the work that we do. So the other piece I wanted to just add, and I'm not going to really have time in this webinar, is I as a social worker and mental health professional, I wanted to just add this piece of understanding of where the structure of social belonging comes from a psychological perspective, that, you know, this whole we feeling or the sense of affinity that we have, you know, that need of attachment, loyalty, and solidarity. And so with that whole attachment, loyalty, and solidarity, and then putting all that to as an outcome of being able to have that sense of affinity or that we feeling, or that, I guess, you know, we're using the word social belonging. So I wanted to just, again, add that layer to frame that where all of this mindset is coming from in combination of all the different work that we're doing. So now it's to the meat of what most of you came today, is to, like, so how do you do all of that? How do you implement the spectrum of prevention, the collective impact? How do you understand the constellation to figure out how to implement equity work? So part of a lot of it is being really intentional and paying attention to what our goals are and what it is that we want to achieve. And so all of our actions, all of our activities, and what we support and who we recruit and how we go about gathering people is with both intention and attention in terms of how we plan it and how we coordinate, how we manage. And then so it's a whole year-round process for us. And it's happening in small groups, whether it's just our executive director and our president, or just the board, or the whole planning committee for the summit. So it's always with intention and attention in how we infuse fostering belonging and making sure that everyone feels that they own everything that we're doing at the statewide level. So with that, I think part of how is changing this mindset of that, and as an organization, we've changed the paradigm that it is really a shared leadership. In essence, you know, we are, as for a large state as we are, the California Breastfeeding Coalition has a part-time executive director who's very dedicated and has done a lot of work beyond the hours that we pay her. And then we have a couple of temporary clerical support help. So it really is a volunteer-led organization in a sense that everything that we do in bringing all the people, whether it's on the board, again, as a committee, is that everyone has equal power in the sense of providing their input and idea in the work that we're doing. So also wanted to be able to, so when I was the chair of the board at California Breastfeeding Coalition, one of the pieces I think that was important is developing the board. And so this is from Kuzis and Posner from their book of Leadership Challenge. And so these are leadership practices I think that fits real well in the work that we do, but definitely fits well with collective impact. And so when you're talking about convening and bringing different groups of people, and how do you inspire that shared vision so that we're all working, you know, for that same common purpose and measuring the same things. And so part of very early on being able to get the board's buy-in that we needed a leadership framework that we can all develop ourselves and be able to use as a way to guide the work that we're doing. And so we've invested that time and energy to be able to develop our board members, as well as anyone else who is on serving as chair or co-chair of our committee. So this framework, again, you know, modeling the way, inspiring a shared vision, challenging the process, enabling others to act, and encouraging the heart. And so the examples I'll be giving you, you'll see how much intentionally and the attention that we pay all of these different leadership practices play out. And I'll kind of keep trying to link some of those as well to this. The other how is then really understanding how to build community and then that whole capacity building. So this model, and I know that there's a link to the different handouts, so I'll send out another link to this particular booklet to help you understand a little bit more about how to engage your community. And so again, here in this engagement triangle, one of the key component is strengthening the relationship. So in every opportunity, there's always that relationship building that keeps coming up. And so wanted to just point out again how important that is in any of the projects that you're working on, and in this particular framework where it's about community engagement, it shows up again. So part of, part of what Peter Block talks about is looking at the art of convening. So how we gather people really matters in terms of how they feel when they come to any webinar or even events or any meetings that we're hosting. So being able to make people feel that that space for the key stakeholders and members of your community, that they are co-creators of that. And so being able to manage that experience that they have when we come together, so that they feel deeply engaged and committed to what it is that we're doing. So part of what we want to be able to emphasize is that you want to be engagement centered. I know for those of you who work in hospital center, you've heard the term patient centered. So in this case, engagement center is that keeping community members engaged, so that what the work that we're doing matters to them, but matters to the whole collective, is a key goal of what we're trying to do. So at California Breastfeeding Coalition, we have our annual convening. We were intentional about referring to it as a summit, and we've kind of in our conversation kind of gone back and forth, and in that, that we really are fighting for the idea that this is more than just a conference. In fact, we actually don't want to think of it as a conference in a sense that, there's so many breastfeeding conferences that they can get their CEUs and learning, that we wanted people to experience the summit as with everybody at the state level, as a way that we all gather and learn from each other, but also share resources, different tools, and then build that relationship and be able to inspire them and motivate people, so that when they leave the summit, they actually have the plan or the intent to implement what they learn and the resources that they've shared, to be able to actually use those resources. So we started the summit about 9 years ago. So it started with less than 100. So now this past couple of years, we've had over 500 people attend our convening, our summit. And next year, so it'll be our 10th year anniversary. So we're trying to plan a big event to mark that milestone. And so I think that in itself is an achievement in terms of being able to pull diverse groups of people, so to come together annually, to be able to do that. So, and the other part that's amazing about the summit is that it's actually volunteer driven. Again, I told you we only have part-time people, and so everything from registration to putting together the decoration to the planning committee, and so part of what Peter Block talks about in that, when you create that sense of belonging and people feel that they're part of the community, and so there's ways that then for people whose gifts and talents are otherwise in the margins and not recognized, we try to draw that out and bring that out. And so one of the tools that we use, if you haven't used it and not familiar with it, it's Sign Up Genius. And so with the Sign Up Genius, we send it out, periodically for different things that we do. So in particular for the summit, it's open to whoever wants to join the planning committee. And even with the planning committee, we have different subcommittees that people can sign up for. And then on the day of the event, same thing. You could be the photographer, you could be the welcome greeter, you can help with the reception event that we have. And so there's different opportunities for people to sign up and be a part of the event, because otherwise we can't run, for an event that's for 500 people, it can't run effectively with the number of people who are so dedicated in helping us. And again, each year, the event just keeps growing and growing. And so I think with that momentum that we have, I think there's also that same energy that people really feel that there's a part for them in this whole process. And so then, we have people signing up for more than just one task, before, after, during, the summit, as well as some of our other events. So one of the key components that I'm going to be talking about today is this notion of connection before content, which Peter Block talks about in his book. And so part of what this activity, or this way of, I guess I would say it's more of a mindset that before you start any meeting, or before you start, in this case, the gathering, the convening, is that people really need to connect. And so being intentional about how people connect with one another. And so this is more than just a team building activity or an icebreaker. I think most people will think of it as an icebreaker. So part of a connection before content really needs to be related to what the topic you're going to be talking about, as a way for people to begin to build that trust and understanding and getting to know each other. So I'm going to show you in the next few slides some examples, but there's also a separate document that's part of the handout that are templates that you can tweak and use. Feel free to use them. And if any of you have some connection before content, we're always looking for great ideas. So here's one that's really more of a combination connection before content and icebreaker. So this is one that I used in a workshop that I led on facilitating effective meeting. And so this is a people bingo. As you can see, some questions are just to get to know, kind of icebreaker, but some are more intentional as far as, because the workshop is about meetings. So we wanted to be able to start talking about, how much of your time is spent in meetings, and then who in the group is a coalition leader. And so and then this other question about, what special talents people have. Again, it's that whole, what gifts and talents do people have that they bring, and their knowledge and background. So, and then, here the question about language fluency, speaking different language, again, integrating, our idea of diversity and being able to draw that out. And so this is, like I said, a hybrid of an icebreaker, but also kind of, we use it as a connection before content. So this one is a connection before content, intentional, that before we started the summit or conference, so our topic that year, we actually used the World Breastfeeding Month theme that particular year, or maybe it was the year before and we used it the following year, of circle of support. And so in this connection before content, so it's a handout, we wanted people to collect ideas from each other on what are they doing to support families, to support in the workplace, and other ideas. And then so they're collecting ideas from people at their table, And then they start out with their table, and then they move around the room to find, and then so then that way they can keep in contact. So if they're interested in the crisis response emergency and they know, Martha had a great idea on, how to do this during earthquake. And so we wanted them to start collecting their network and building their network. So this is one. And then, of course, we wanted to be able to, when they turn it in, so we want to incentivize them to do it. So they get raffle tickets when they can show us that they've completed this circle of ideas. Another year, we actually copied USBC. So USBC had this sign that says, why you promote breastfeeding. And so in this case, we did it for one of and actually we did it the same year that we introduced the constellation at the summit. And so here you see different attendees or participants sharing at their table why they promote, protect, support breastfeeding. So this is part of our connection before content. So this one is a little bit more in depth in that on purpose. This one we use for our board retreat. As you know, with boards, we needed that stronger connection, and we needed board members to build that trust. Because the board makes crucial decision, and so we, encourage dissent, so that way we can really figure out what's best for the future of the coalition. And so this one is the head, heart, hands, and hope. So you can see kind of the questions there. So the hope part, again, tying it into what their hope as a board member for the California Breastfeeding Coalition's mission and vision. So we gave board members time to think about it, and then we each shared what's in our head, our heart, our hand, and our hope. So again, these are just different ways that we try to build that relatedness and connection. So the other piece I think that's important is facilitating dialogue, or really being intentional about creating those opportunities for people to have conversation, and because that's your way of building relatedness. And so part of what Peter Block talks about 5 conversations that structure belonging. And so, and I think that we, as best as we can, facilitate different conversations. So conversation around possibility, so when we first talked about what our vision would be, one of the possibilities, if we were able to have no smoking, in restaurants and smoke-free facilities, wouldn't it be great if we can have the possibility of there's no barriers to breastfeeding? And so those conversations around that, and that's how we ended up with our vision statement, is that we've had those conversations around possibilities, and then conversation around ownership, just in terms of all of the different initiatives that we have, and of course dissent. And so we really encourage diversity, in thinking, but as well as diversity in terms of who is not just at the board, but who is part of the coalition and who's there. So as mentioned earlier, I, as a social worker, I'm not too many social workers are at the summit, or even at the in the breastfeeding world, and so, but then we really try to encourage different perspectives as well. And then so conversation around commitment, and you'll see that I'll give you an example of how we facilitate that conversation around commitment, and then of course the conversation around gifts. So that's we wanted to be able to recognize and value people for their gifts and talents. And again, I have some other examples of how we draw that out and bring out people's gifts and talents. So the next few slides is how we facilitate these conversations and dialogue. So this one activity is called Starbursting. Again, you have a handout on that, and so that you can create your Starbursting activity. So the Starbursting is really, and some of you may be familiar with that, like question storming, or really asking questions. So in this particular activity, at the center of the star is the topic that you're focusing on, and so each star might be different topics. So this particular workshop is on that effective meeting. So one of the key issues that people had was on attendance, and that's what the picture that you see there. So now all the different groups in members of that group are asking questions, so not answering them, just asking questions, and so there's that one, for example, on attendance. How did they hear about the meeting? How did they get there? So all the questions that starts with how, and then questions that start with what. And so part of this whole idea of generating questions is being able to then, through those questioning, generate some ideas from that. But really, and I agree with Peter Block when he talks about that asking questions are really more transformative than just coming up with ideas. And so, whenever you can facilitate people to draw people out, to ask questions, and that's why people feel less intimidating to ask questions than they are like if anybody have an idea, and so people feel vulnerable because, oh, what if my ideas sound stupid? But questions are just questions. Either they're curious, and so you wanted to be able to elicit those questions from the group. So here is where I was talking about. So so we have intentional different days that we wanted to group people in small groups. So in this particular picture that you see, it's people from same cities or counties to be able to sit together. And so they have worksheet on putting into action, what can you do to implement. So this is actually at the end of the summit, and so we based on what they learned during the summit, what ideas or what key learnings they're walking away from that they can implement in their county. And so this particular lunch period, we wanted to be able to engage the different counties to start planning and figure out a way to implement. So again, being able to facilitate in small groups these dialogues. But we also, in of course, like with any other gathering, there's open mic or open forum. So we still, we want to encourage for people to be heard, even in the large arena, large conference room that we have. And then for the leaders and for the people who that are key stakeholders to really listen. The other approach that we used, some of you might be familiar with World Cafe. So this World Cafe is really more designed for larger groups to engage in dialogue. And so there's a lot, so I'm not going to have time to spend in kind of how-to on World Cafe, but there's a lot online that you can get toolkits on how to facilitate World Cafe conversations. So we've done World Cafes quite a few times, actually, so in different formats. So these are some pictures from that. Again, whenever we can, try to mix up the group as well, in terms of making sure that people are sitting with other people to interact. So, and then this other picture that's we posted the ideas that people had, and that way other groups can see the responses and be able to learn from them. So this is another activity, not quite World Cafe, but it's again more intentional in terms of facilitating dialogue, being able to have some conversation on a particular topic as far as how do you engage people in diverse, again, this in particular talking about diversity. So the other piece, and I mentioned earlier, one of the leadership practices is modeling the way. And so I was trying to figure out some pictures of image of how do you model the way of conversation and dialogue. So I think one of the fun things that we have done, and this was actually, Carol Melcher's idea that we just came up with, like, let's make the stage, the panel, more like a Oprah setting, so we'll bring out the Oprah in us, just in terms of the couch conversation, so that the panel, it's it's more intimate, and so that we're having these girlfriend conversation, or in this case, just friends conversation with this audience of 300, 400. And so that whole two-way dialogue, when you change the setting and the visual, it just feels a little bit more intimate. And so that's this picture of us being able to model for them on how to have these conversations. This other picture that I have, we had a panel, and so that's when the conversation around diversity and equity, and so I'm being able to model the way of how do you talk about some of these difficult conversations and what those needs are and what's really going on out in the community. And so these, we have a mom and then some WIC staff having, sharing their stories, both as a mom but also as WIC breastfeeding advocates. And so these are different ways that I think we model for our community in terms of how do you have some of these tough conversation, and how do you make it a little bit more intimate so that, we are really listening to each other and having, when you have a large group, people feeling that they're being heard. So the other one is hospitality. So, Prita Brock also talks about hospitality, but more so for us is being more mindful about how we welcome and bring people together. And so there's a lot that we have done in this, again, being more intentional in terms of how we do it. So where this comes from really, and this slide in particular is just, I know I picked it because it's just a good visual, but it's really an example of how the banking industry has shifted from just a service, or goods commodity type of organization to experience. So we really are now in the experience economy, and so what's referred to as experience economy. And so, that's why Starbucks is successful in a sense that, why pay, $5 or so or more for a cup of coffee, but part of that is you're getting that whole experience of ordering a personalized drink with all of these different ingredients that you want in it, and the atmosphere of going into a Starbucks. And so Starbucks is built on that experience economy. A lot of the different in hospitality industries, really not just providing the service of a hotel room, but really trying to figure out ways to compete in that space, because that's become, their marketing or what makes them different. And so part of what we were intentional about, what makes our summit, our gathering, different than any other conference. And so we really had those dialogue, and so creating some of those experiences. And so part of what we've done is create these memorable moments of surprise and delight, and some of them from pretty simple to different fun activities that we've done. So the next few slides are some of those examples of how we've created that experience of coming to the summit. And that's why I think that each year we keep growing in terms of the number of people who come, and not just for the content that we have, but just the whole experience of coming to the summit. So here's one pretty simple, is that, we actually already had this background of California Breastfeeding Coalition. So the first time we had it out, we noticed people like taking pictures, with it, like as if you were in a red carpet, they took selfies. And so we decided, like, what if we had a photo booth? So the next year, I just really went to the dollar store and just bought headbands and sunglasses and just different props, for $1, and just added, so each year. So now I have this whole, big bag of different props that we've keep adding over the years to make it more fun. And so these are just fun pictures so every year that people get to take group picture, and then we have California Breastfeeding Coalition in the background, and then they have these memories they can share in their social media, and so then we get a lot of leverage, but then it's one of those things that just, part of the whole surprise and delight that people, like to take their photos, and we have all these different props, and so every year we have to keep adding a few different, props, and then we get people donating, some of their other props as well. So part of what I firmly believe in, so one of the things that I do is I am a certified Daring Way facilitator, which is really basically saying that I've been trained to use Brene Brown's curriculum. So part of that whole curriculum includes this laughter, song, and dance. And so, part of us feeling connected with each other is through music, is through dance and song and laughter. And so because that's part of our humanness. And so so part of what you'll see is how we've done that. So here's one, I really love this. This is one of my memorable time that we had. So we had, when we introduced the 7 barriers to breastfeeding, one of our members who's very gifted and talented, Lisa Robinson, created this skit for us. And so we had Snow White and the 7 Dwarfs, which is basically the 7 barriers. And of course, we wanted to show diversity. So we had 3 different Snow White. Myself here on the left side is Asian Pacific. And then Tamisha's half African American and Latina, and then a white. And so we're wearing this, someone made these scarves that looks like with nipples. So then it looks like a breast, it's a breast scarf basically. And then we have our dwarfs there. And I can, you'll have this PowerPoint, so feel free to use, the skit if that's something that you want to do. But when, we won't have time to read the skit, but when you read it, it's so funny. And when we did it, it's just really was a surprise for everybody. But at the same time, we made that whole learning fun about, what are the 7 barriers, what made sense for us as well. I think when we were having this planning is that the year that we did this skit, we were actually in Anaheim, so we were just a mile away from Disneyland. So it just kind of made it all work. So the next slide, I will be embarrassing myself, but this is the year that we introduced the constellation. And so our connection before content, we had a cutout star. So we wanted people to put their name and what, whether they support, teach, or advocate, or is a resource. So that was our acronym for the star. So the skit that we had this year was, because again the theme was the stars. So we had Star Wars, Star Trek, Miss Piggy in space, and so there's me as Princess Leia with actually that's ear muff that we just put the breast model. So that's my headdress. So a la Princess Leia there. So for those of you who know me or don't know me, I'm more of an introvert. So for me to be in this space, but I was the president at the time, so it's just one of those things like, okay, just, it's part of the role, so let's just do it. But I had fun, so we, that's the whole point is having these opportunity for people to experience coming to the event. So we also have, during the breaks, music, so people can either dance or Zumba as part of the stretch break. And of course, as always, we want people to feel comfortable, that it's, a mother-baby friendly gathering. And so we actually also have a lot of different rituals. So this top picture is, we haven't been able to replicate this for a few years now because we keep growing. So this is our baby-friendly hospital parade. And so, all the different hospitals that have been designated come into the room. And then this bottom picture, we want to recognize who's in the room. So I know everyone has done, typically do this, like how many have been to the summit for 8 years, 7 years, 10 years. So this is a way for people to kind of see who's in the room, but also being able to, for the people who are first timer in our summit, we wanted to be able to kind of connect them with the people who've been there a long time. And so we can see who the new ones are, and then we can be intentional about connecting with them. So we do a lot of awards. So this is one that we do now. So we have now 95 baby-friendly hospitals in California. So every year we recognize the new ones who've been designated. We also have at the state capitol, we do a mother-baby friendly workplace award, so where we recognize. So these are where different community members can nominate, their organization or their workplace that they're, meeting the criteria as mother-baby friendly workplaces. And so this is an award that we give at the state capitol, and we have some politicians from time to time to be there as part of the award ceremony. And then we use a lot of storytelling, right? So storytelling really helps people connect with, the wisdom and solidarity and the commonality of the experiences. And so when, we have those opportunities, we want to highlight those lessons learned and then give people the opportunity to share their story. So this is one just kind of emphasizing in terms of why stories matter. And so I mentioned that already earlier. And so for us, also part of our leadership practice is we are intentional about, recognizing people who've done a lot for the state. So we have our Golden Wave Award for people who have done a lot for the state, both in their local county and the work has continued to influence the work we're doing at the state level. And then we also have our Rising Stars. So we're mindful about leadership continuity or our leadership pipeline. And so we, recognize those one or two individuals each year who are emerging leaders. And then this is it. So I wanted to just kind of end here. So one of the things that we actually also do is we give different scarves each year. So they become kind of one of those coveted things. So we have different scarves for each year that we give to our speakers, presenters, and also our volunteers. So this is just a picture of myself. If Inwa is at the center, she's our current board member. And so I wanted, and we have our volunteers, but then actually they were volunteers for our summit for several years, and now they're actually board members. So this is our other way of being able to help people feel comfortable that they have a role, and that there's those opportunities to do more than just volunteering at the event. And then, when we see the potential in them, we encourage them to apply to serve on the board. So I'm going to end with a quote from Brene. So this one is, a deep sense of love and belonging is an irreducible need for all people. We are biologically, cognitively, physically, and spiritually wired to love, to be loved, and to belong. When those needs are not met, we don't function. We are as we were meant to. We break, we fall apart, we numb, we ache, we hurt, we get sick. And so with that, we'll open it up for questions.
Wonderful, wonderful. Thank you so much, Ernie. This is Amelia Pasmais with USBC. I'm going to moderate a brief comment and question period. Please, everyone, if you have questions, put them into the question box, and I can direct those to Ernie. We just really wanted to thank you for demonstrating these very practical and efficient ways that we can create belonging. And I love the overarching theme of the work that you shared, highlighting that, play and fun and the surprise and delight and the ways that creates, I guess, both breaking down the formality that could separate us, but also you mentioned create something that is memorable, and then that becomes a connection perhaps that holds us across times that we have the opportunity to be together. A few different people responded to the prompt to write into the box their ideas of belonging, and there were two that were connected to one another I wanted to lift up. One comes from Shatoria Townsend, who says that she's the State of Michigan Breastfeeding Coordinator, and that her definition and idea of belonging is the ability to share my truth and know that it is welcomed at the table wherever it may be. And then we also have a question from Cindy, or a comment from Cindy Calderon, who says, belonging is being part of decisions to implement changes, having an equal voice, and bringing to a group your skills and knowledge. help in the implementation and celebrate gains and evaluate gaps. And, Ernie, what stood out to me about those two comments and the impressions of belonging is both of these people, I felt, were sharing part of the impact or the outcome of belonging, that once belonging is there, then there's this other possibility, perhaps, for the collaborative action. And I wondered if, what comes up for you, what comes to mind hearing those two comments.
Yeah, I think definitely. So I'm just going to share my experience. So feeling vulnerable in a space where I'm not a breastfeeding expert. I've never breastfed, but I did lead a baby-friendly hospital initiative. But really feeling that I can be my authentic self and bring my own gifts and talent to the fold and be part of that decision making in terms of how the organization is going to grow and what our goals are. It just perpetuates us. So when I feel like there's a space for me, then I give more and then I do more. So each year I show up, because I feel like this is my tribe, this is where I belong. And so I think that it just kind of helps in that sense to just keep building that.
Wonderful, wonderful. And Naomi Baryam has submitted the question asking if the California Breastfeeding Coalition meeting and conference, is that one day or multiple days?
It's actually, it started out as 2, then it's now become 3. So we've had 2, and then we thought, we had a pre-conference just for the coalition, and then now, it seemed like 2 days is not enough. So it's become a 3-day event. So it started out as 1, and then 2, and then now it's 3. So as an annual convening. So it's usually the last week in January.
That's great. And I'm imagining that the longer you stay together, the more you want to be together, since you make it so fun and you're able to play with one another as well as learn.
Right, yeah. And then again, we try to bring the latest topic, and so everyone has their different pulses in different areas. So whether it's research, because then we have board members and committee members who are teaching in the university, and then, or like in my case, I bring a lot of the mental health perspective, and so trying to make sure that that's added. And then the WIC and policy. So Robbie, our executive director, always, making sure that we have a presentation on policy and what's going on.
Wonderful. That's so great. Well, there's many comments in the chat box just reflecting how grateful we are for your time and all the great ideas that you shared. I know that for the USBC staff team, we're all oohing and eyeing over the Oprah stage and how automatically that translates and communicates something different when you have that sort of living room feel. So you might all see that coming up at another USBC conference.
When it's possible, it's great, and it's not always possible, but, we actually, we'll tell them, oh, we saw this couch out in the hallway, can we move that? So we just do that, so yeah.
That's great. You're right. You can be creative and flexible. It doesn't have to be complicated in order to make an impact. That's a good reminder.
Yeah, great.
Well, wonderful.
So on the slide is my contact information. So again, if any of you want to reach out, there's my email. We have more connection before content ideas, templates. So feel free. We're open to sharing any of them.
Thank you so much. And thank you, everyone who was able to join today's webinar.
Thank you.